Welcome everyone, Dylan Gemelli here today with a brand new video for you. So today we're going to talk about DHEA, and I have been getting so many requests for this for so long, and I'm sorry I haven't done it earlier, but today is the day. So, before we get into that, I have to reiterate that I am not a doctor. Anything I say in these videos is for your entertainment purposes only. What you do with this information is completely and utterly up to you, and I am not advising nor condoning you to use any of the things that we discuss in any way, shape, or form. So let's get into DHEA. There's a lot of stuff to cover here, as I'm sure many of you will know. And I just want to make sure that I always try to get to what's requested of me. We know that balancing your hormones is one of the keys to looking and feeling better. Now, there's many natural ways to do this. Medications, supplements, they can alter your hormonal levels and provide you some health benefits. Now, DHEA, I hate trying to say that too fast or you sound ridiculous, but DHEA is both a natural hormone and it's a really popular supplement that can affect the levels of other hormones within your body. Now, it's been studied for its potential to increase bone density, decrease body fat, improve sexual function, and to correct some hormonal problems. So we're going to cover all of that here. So what is it? How does it work? So it's a hormone that's produced by your body, as I pointed out. Now, some of it is converted into the major male and sex hormones, testosterone and estrogen. Now, its effects can be driven by the actions of testosterone and estrogen after this conversion occurs, as well as by the DHEA molecule itself. See, try to say it too fast, you sound stupid. Now, given that it's actually produced naturally, some wonder why it's even consumed as a supplement. Well, the main reason is that because DHEA levels will actually decrease as you age, and this decrease is associated with several diseases. So you got to be aware of that. It's actually estimated that DHEA will actually decrease by up to 80% as you get older and throughout adulthood. So this isn't just relevant for older adults either, all right? It actually starts to decrease around the age of 30, kind of similar to HGH, where you start to see those levels decrease as well around 30 years old. Now, lower levels have actually been associated with a lot of things that are not good, like heart disease, depression, mortality. So when you take it as a supplement, it actually increases the levels in your body. Now, some of it's also converted into testosterone and some of it's converted into estrogen as well. So increased levels of these hormones produce a variety of effects, which will actually be something that I discuss here, here shortly throughout. So let's talk about bone density. I pointed that out earlier. Low DHEA levels are associated with lower bone density, which decrease as you age. All right. So low levels are also associated with an increased risk of bone fractures and injuries that could occur. More fragile bones, a lot easier to get hurt and suffer, nagging or, even worse, more severe injuries. So several studies out there have actually examined whether it can improve bone density in older adults. Some research shows that by taking DHEA as a supplement for 1 to 2 years can actually improve bone density in older women, but it didn't show that for men. So there's other studies out there that have actually observed any bone density benefits after supplementing with it, but most of these studies, they only lasted 6 months or fewer, so I guess I would call them inconclusive. Now, it might be necessary to take it for longer periods to actually, experience increased bone density, and it just may be larger in older women, but I haven't ran across too many people that come to me and go, oh man, this thing really helped my bone density, I just don't see it. Now, it also doesn't seem to increase muscle size or strength like one may think. So due to its ability to increase testosterone levels, then that automatically makes people believe that it can increase muscle mass or muscle strength. The majority of research that I've seen actually shows that this DHEA supplements don't increase muscle mass or muscle performance, all right? This has been shown in young, middle-aged, and elderly adults, all the same, over periods lasting from 4 weeks to 1 year. Not promising either. So there's also some contrasting research out there that has been reported that it can improve strength and physical performance in frail older adults and people that have some adrenal glands that aren't functioning properly as well. But there's just several studies out there that show it didn't improve physical performance in older adults at all, but others out there have reported increased upper and lower body strength. Now, that would make you wonder if that's more of a placebo effect. I don't know. I don't have the answer to that. But because a large number of studies out there don't show any benefits in muscle size or strength, it's probably not effective, or not as effective as people may make it seem to be to you. Now, the effect on fat burning is also very unclear. So it's sure you see the pattern here of a lack of clarity, which I don't care for. The majority of the research out there on fat burning is that it's not as effective either. There's some evidence that suggests that the supplements can produce small decreases in fat mass in elderly men or adults with adrenal glands, once again, that don't work properly. But one study found that it decreased fat mass by about 4% over the course of 4 months, although this was in patients that had adrenal gland problems, not just your normal everyday person. While the effects of like standard DHEA supplements on fat mass aren't impressive, a different form of DHEA could be a little bit more promising. So this is called 7-keto DHEA, and it's been reported to increase metabolic rate in overweight men and women. And I can tell you, I've seen some people do quite well with that. Now, there was a study, it was an 8-week exercise program with overweight adults, body weight, fat mass decreased 3 times more after taking 7-keto DHA supplements compared to placebo effects. Now, in this study, people that were taking the supplement, I believe they lost about 6.5 pounds of body weight and about almost 2% body fat. Now, those in the placebo group only lost about 2 pounds, a little over 2 pounds, and like 0.5% of body fat. So there's a lot more research that's needed, but it is possible that this form of DHEA could help you lose fat. And I can tell you firsthand that I have seen people do quite well with 7-keto. But that form, not just regular DHA. Now, it may play a role in fighting depression. Now, the role between depression and DHA are, it's kind of complex, all right? There's some research in women that are nearing menopause that showed that, because they had depression at higher rates, that there was some promise there, but some individuals with severe depression have lower levels of DHA than those with milder depression. So it's something to consider as well. While the relationship between the two isn't entirely clear from what I've read, there's a lot of researchers that have studied whether taking it as a supplement can even improve symptoms of depression or not. Some research shows that it can aid in treating depression, especially in individuals with mild depression or people that just don't respond well to normal treatment. Other studies have shown no improvements whatsoever. It's terribly confusing when you see the studies and you see them, but I have to tell you, what's out there, and there's just more information needed. Everything is so inconclusive, which makes me wonder if it's more of a marketing gimmick than anything. It's possible that it can improve sexual function, fertility, and libido. Now, it's no surprise that a supplement that affects male and female sex hormones also affects sexual function. I think we can all agree on that. One of the things that I know of is that it can improve the function of the ovaries in women with a problem with fertility. Now, here's something that I came across too. It increased the success of vitro fertilization in 25 women that were experiencing fertility problems. So that is promising. These women underwent IVF before and after treatment. Now, after treatment, the women produced more eggs and a higher percentage of eggs were fertilized. We're looking at almost 70% as opposed to 40%, so that's pretty good. One study found that women that took the supplements during IVF had a 23% live birth rate compared to 5% in the control group. Also very good. Now, several studies have shown that these supplements may also increase libido and sexual function in both men and women. So finally, we're getting somewhere here. All right? But the largest benefits were seen with people that had impaired sexual function. Oftentimes, the people that didn't have any sexual problems didn't see any benefits. So there's always a catch here with this DHA studies. Now, it can correct some adrenal problems. As I keep bringing that up, you keep hearing that over and over. The adrenal glands are on top of your kidneys, all right? And one of the main producers of DHEA. Now, some people have a condition called adrenal insufficiency, and that means that the adrenal glands can't produce normal amounts of hormones. This can cause fatigue, it can cause you weakness, changes in blood pressure, it can even be life-threatening. Now, these supplements have been examined as a way to treat symptoms of adrenal insufficiency, and some research actually shows that they will improve the quality of life in people suffering from this problem. Let's talk about some dosing and side effects, because I think I've confused you enough with the studies now, but I have to be honest with you on what's out there. Doses on 10 to 500 milligrams have been reported, but a common dose is 25 to 50 milligrams per day. People have reported, and it's been shown to be safe to run 50 milligrams a day for a year. 20 milligrams per day has been safely used for 2 years. Now, generally, DHEA supplements have been safely used in studies for up to 2 years without any sort of severe side effects. Minor side effects have been like some greasy, oily skin, acne, and increased hair growth in the armpits and pubic area. So be aware of that as well. People that should not take these are people that have cancers affected by sex hormones. It's best to speak with a physician before you start supplementing any DHEA, all right? So basically, to summarize this, after all this confusion, to make it simple for you, the effects that are often associated with DHEA are primarily seen in people with low levels and certain health conditions. All right, so if you don't have any of those issues, chances are you're not going to see much of anything. Young, healthy individuals, you don't need to take it at all. It's produced naturally in your body, and it doesn't mean that more of it is better. It just means that keeping an adequate amount of it in your body is what's needed. And if you've already got an adequate amount, it's not like it's going to benefit you anymore. All right, at all. If you have, low levels, if you're an older adult, you got certain conditions with your adrenal glands, sexual or fertility problems, then there's a good chance that it might help you to certain extents. But I think there is more hype than hope when it comes to it, but take it for what it's worth and you be the judge. That being said, www.icearms.com/forums. I'm also on the Evolutionary Forum as well as the Elite Fitness Forum. You can also email me, Dylan@icearms.com, and please don't forget to subscribe to the channel. That being said, stay tuned for plenty more to come. Dylan Gemelli, signing off.